We know that someone in a nursing home, hospital, or daycare is vulnerable. But for months, the government has quietly stopped doing important inspections. In a special Dirty Dining report, we found the legislature blames it on budget cuts, but it could be putting many people's health at risk. Dwindling budgets impacted many bills in Tallahassee this year, but one bill could have a big impact on our health.
I think people need to be concerned that their public health protection can be taken from them so easily without anybody saying anything.
The budget for the Department of Health was slashed. The result? No more food safety inspections in hospitals, nursing homes, and daycares.
This is an important issue that it potentially affects 1 million people out there in our institutions. This is not a small thing to remove public health protection from these people.
Roy Costa, a former state inspector and public health consultant, is concerned. Even though DCF has now agreed to take over food inspections at daycares, hospitals and nursing homes have not been inspected by anyone since July 1st.
I would like to know whether or not they consider the impact of what they do before they make a decision. I'd also want to know why there wasn't public debate about this.
That public debate may have revealed from July 2009 through June 2010, there were 14 nursing homes and hospitals in Hillsborough, Pinellas, and Pasco counties with unsatisfactory inspection scores. The Department of Health refused an on-camera interview, but the governor's office provided this response, saying, quote, "The Department of Health no longer had the money to continue inspecting facilities. Unfortunately, Florida statutes will need to be corrected to implement the food safety inspections again. Until a change is made in the next legislative session, there will not be inspections by the Department of Health at nursing homes or hospitals." But waiting until the next legislative session may be too late, according to Sarah Klein with the Center for Science and the Public Interest. She's worried our most vulnerable population is not being protected.
Unfortunately, we could see an uptick in foodborne illness outbreaks from these locations if we don't have inspectors on the ground ensuring that food safety practices are being followed all of the time in those kitchens.
Now, Roy Costa says most large hospitals have their own inspection process, and here in the Bay Area, the hospitals have a very good inspection history. When the next legislative session begins, you can be sure we will stay on top of the story and see what the state decides to do about future inspection.